Hello, everybody. This is Swati Kandaya joining in from Sri Lanka. Thank you very much for joining Zaharas Dream Southeast Asia's third Be You Powerfully talk. The layout of today's talk is going to be a little different from the other talks. It's going to be a question and answer session. And this conversation will be focused on women's health. Because as Michelle Obama once said, communities and countries, and ultimately the world, are only as strong as the health of their women. So to speak about this very important and interesting topic, we have with us Carmen Roceli and Lopez. So before we dive into the conversation, let me introduce Carmen to you. Carmen is a Filipina feminist. She's a nurse by profession who has chosen to become a gender and development worker. She's currently the assistant project manager of the Supporting Women's Economic Empowerment in the Philippines project, or Great Women Project 2 of the Philippine Commission on Women, funded by the Government of Canada, that supports over 800 women in micro entrepreneurs in the Philippines. Carmen has over 13 years of experience in development work with multiple organizations focused on community health, training and development, and project implementation. She has a bachelor's degree from the University of Santo Tomas, the oldest university in Asia, and has a Master of Arts in Women and Development with an Academic Excellent Award from the University of the Philippines, Diliman in 2019. In 2013, she was the youngest recipient of the Atom Award, an award given to outstanding alumni of the Manila Science High School, the first science high school in the Philippines. Carmen is passionate about building a better ecosystem for women's economic empowerment. Through the Young Southeast Asian Leaders Initiative, Futurepreneurs Economic Workshop of the US Department of State, Carmen and her colleagues have jump-started a project called Her Store Asia, a digital platform that seeks to uplift women artisans and enterprises across Southeast Asia. So some really cool work and great experience, Carmen. It's a pleasure to have you on Zaharas Dreams Be You Powerfully talk. So without further ado, let me jump into our first question for the day. So let's start off with this, right? I would like to hear your journey as a nurse and what led you to shift your course into development work.
Hi, good evening, Swati. Thank you for the introduction. So yeah, in terms of how I ended up in what I'm doing right now. So when I wanted to be a doctor, actually nursing was just a pre-med course for me, no? I wanted to be a doctor, and that's why I studied to become a nurse. While in university, we got exposed to various community extension programs, and I ended up being assigned to communities. So these are urban poor communities across Manila, which are very much marginalized. They lack services that in terms of health, education, and I got exposed to, I would say, the real world. Because I mean, we're not rich. I grew up in a family. My parents were teachers, but they always valued education. No? So that's something that I saw in my family, my brothers growing up, and well, I valued my time in the hospital, but there was some kind of fear in me, in taking care of people, So at one point in time, while on duty, while on my internship, we lost the patient, on the table. So that's when I thought to myself, maybe there's something more that I can do outside of this hospital, outside of this clinical facility, so that this person and all other persons do not end up here. in a state, no, of dying. So that's how I thought of preventive and promotive health, and that's how I think it came to be. Like I didn't want to stay there, so I should be doing something in the community first, no, before well, so that they could avoid ending up in hospitals. So yeah, from then on, I thought to myself, yeah, I told myself that it was something I will pursue, and that I was going to take that kind of road, no, something that is less traveled.
Great, great. Thank you. Thank you for sharing that story. It was really, um, touching and inspirational, and like it gives a lot of perspective, as a medical professional, what you can do, and you step out of that field with another vision, but which also aligns with the whole, system of, again, giving back, or like working for the health of the people, which is great. So moving on. So according to the World Health Organization, the WHO, being a man or a woman has a significant impact on health as a result of both biological and gender-related differences. The health of women and girls is of particular concern because in many societies, they are disadvantaged by discrimination rooted in socio-cultural factors. For example, women and girls face increased vulnerability to HIV/AIDS. Lack of information and financial independence also leads to women experiencing a lot of reproductive health-related issues. So, Carmen, can you share your experiences around this based on your work with women from the different communities?
Oh yeah, I would like to start with the recent happenings, COVID-19. You mentioned about reproductive health. During this time of pandemic, the focus, we would say, is on how to eradicate or how to respond to COVID-19. And what people have not been able to see is that there are other conditions, we need to secure services for non-communicable diseases, so hypertension, diabetes, and the like, and as well as reproductive health services. So due to the pandemic, lockdowns, quarantine measures have been put in place all across the globe. And here in the Philippines, for instance, it has limited the access of women and girls to reproductive health services. So in that sense, in as much as they would like to not get pregnant during this time because of the difficulty, they've been removed from their jobs, or yeah, they lost their income. The thing is, the control in terms of population was not as easy compared to before because they could not go. Well, one is there was no transportation available to the health centers. Another is they were fearful of contracting COVID-19 along the way. So it created these vulnerabilities among women and girls, no? So there have been increase in teenage pregnancies. So that's a pressing problem that it increases, maternal mortality rate when someone is not yet ready to become a mother. No, it's not a good thing. No, so aside from the reproductive health services, then you have also different types of violence. So during this time of pandemic, it's not just physical violence, but it's really mental and emotional. So these factors no affect the overall well-being of women and girls. And in some of the anecdotes that we've heard from the women that we support no in communities, uh, it has been rampant. And until now, although things are getting better, services are needed, no, to be able to respond to their cases, especially those in the rural areas, because until now, these areas cannot be reached. And lastly, on the different concerns, no, being faced, access to vaccines per se. So women, they're locked up in their homes. They could not go to the vaccination sites, usually located in the center of town. So they end up being the ones, no, unvaccinated, and they remain, no, vulnerable to COVID-19. So these are just some, and I'm sure, yeah, we don't have enough time, no, to talk about the other concerns of women in terms of health.
Thank you. I would just like to, I just want to get it in detail. Like, definitely, we've all seen like the effects of COVID-19 and like increased cases of intimate partner violence, domestic violence, and the lack of access to healthcare, like you said, vaccination, where women in particular are being, are facing the ripple effects of COVID at the forefront. But even when we go back in time, before the pandemic happened, we could still see, like, I can relate with you and situations in Philippines, because we also have in Sri Lanka these rural areas and women who are completely unaware and uninformed of preventive measures to like reproductive related issues. And even just like that conscious effort to take care of themselves, it doesn't really come from within them, and it's also not very supported by like the family or friends, because again, it's not something that's given much attention to. So I would like you to reflect on your experiences before the pandemic and like speak about the issues women faced in general, in terms of their health.
So yeah, if we are talking now before the pandemic, in certain areas, I would still say that it's teenage pregnancy. Here in the southern countries, it's the maternal mortality rate that is still present. Something that we should have eradicated, avoided many years ago when the primary health care was declared in Alma Ata. These are some of the considerations that have been brought to light, no, surfaced. And even during the time of the Beijing Platform for Action, health has always been at the core, no. And until now, in terms of rights, it is something, no, that is being advocated for. So teenage pregnancies occurring, in not just in rural but also in urban areas, deprives women, girls, as young as 12 years old, not even that's not even considered teenage pregnancy, that's child pregnancy. The liberty, to choose better lives for themselves. And then aside from that, I would say that it's the lack of information, information and access to services that could support their lives, getting access to those who are able to become mothers or are wanting to be mothers, prenatal care, antenatal care, and postnatal care. So you have incidences of women dying, no, in the health centers. There's this video on. There are many videos on YouTube showing these cases. No health professional available, not even a midwife, not even a nurse, not even of course not doctors, no, no health workers also, not to look after the well-being of communities. So these all add up to situations, that lead to not only morbidity, but really mortality. Because when people don't have information, access to basic needs, even getting their blood pressures checked once in a while, getting their vital signs checked, then they are not provided care that could support them in their lives. And nutrition, that's another thing leading to death of infants, because people, although there are resources around the area, people need the right information to really provide good nutrition for their families. So, and yeah, these are the issues, and I think, and aside from the what we have talked about reproductive and sexual health services, these are some of the issues that remain rampant during these times. I hope I got that, correctly.
Yes, you did. Thank you so much. So yeah, it's again, very sad to see that it's 2021 and it's the 21st century and we're still facing these issues, and we still, we're like talking about access to information, although, the internet is there and there are multiple forums. So, this is also one of Zaharas Dream's aims and visions, that is to, spread the word, create more awareness and empower women to manage their lives better. So I really hope, people watching this video, again, like reflect on their lives and take the necessary action to, better lead better lives for themselves and also for their loved ones. Thirdly, I would like you again to draw insights from your volunteering and work experiences and share some practical ways in which women can advance their well-being while living authentically. So we're not talking about, fancy treatments. We're not talking about like access to high-end healthcare or anything, but like, while you maintain or while you try to manage your lifestyle, how can you take simple steps? How can you tackle this in your way to be like more conscious about these things? And just in the simplest of ways, how can women tackle their health issues to lead a better life?
Yeah, in relation to when you are a volunteer, just like in my experience, so I've been a volunteer for many years. Of course, since you are taking care of others, in a sense, you have to take care of yourself, right? So it really entails, I think, taking care of all of the aspects of your health. So from your physical to emotional and to your mental, and even your spiritual, if you are someone spiritual, no, in nature. So practically, like it's the same thing that we are reminded in school when we were young, no, eating the right food and doing exercise. And what is available right now, I would say, is really make use of internet, because there are so many Facebook groups that could support you with your diet, so you don't need any fancy cookbooks. Before, I remember there were like thick books being sold in bookstores that would suggest about South Beach diet, But right now, everything's available on the internet. And the good thing about these communities is that there are other people who can support you. So it's about reaching out to others, no, for guidance, for coaching. So that is your physical well-being is tapping into your emotional and social well-being as well. So joining support groups, while meditating, not just exercising your body, but exercising your mind, no? And following YouTube videos, Spotify, everything is there. Make use of these resources and maximize, no? Because they're all for free. And in current mobile phones available, smartphones, for instance, there are already like tracking devices, counting your steps. We used to not know, no, the importance of walking, but right now we can even count, no, the cell phones have pedometers, so you can count how many steps you're taking on a daily basis. But yeah, other than these things, it's really about preserving also your mental health, taking time for yourself, listening to music. It's so practical, but when you are stressed out, there's no other way for you but to stop. You know, we as women, no, we are very much capable of balancing our multiple burden. You know, doing so many things, so many roles, and what we can do to take care of our own health is, yeah, just to stop and really start caring for our very own selves.
Thank you, Carmen. Like you reflected, yeah, it's very, very important to, stop and reflect on yourself, take time for yourself. Now, we completely understand that all of us come from different socioeconomic backgrounds. Our realities are different. Our realities could be different. We speak about access to information on the internet, smartphone, YouTube, and all that. And there could be, we are also aware that there are people who do not have access to internet or mobile phones or these facilities. So I hope in that case more platforms like her store should should mushroom in our countries and reach out to these women and empower them in terms of technology. Give them that access, empower them so that they have access to information, and then through that they can better their lives. And
Yeah.
I would also like to reflect on what you said, to be a part of support groups, which I think is a great initiative, or a great way to escape the chaos of your life, to take time for yourself, to be a part of programs and little activities that is organized among these little clubs and societies in your own communities, and also find support systems, find mentors, find people who would be able to share their knowledge with you, share techniques with you all. And I think that is something that is very, very important, that we all reach out to. And here again, I would like to give a shout out to Zaharas Dream and invite all young women and men to be a part of this community, because this is why we're there. This is, we are here to give you confidence, to give you more information, to give you the opportunities that we can provide at, our level, to empower you and to, better your lives in any form, really. So yeah, it's great that you shared these information, Carmen.
Yeah, just to respond quickly, Suwati, about what we are doing. Sorry, I just have to bring this up because you mentioned, in terms of her store, our project for next year is anchored on digital literacy. So for women artisans and enterprises. And what I'm talking about, the expectation is that you know how to handle Facebook, social media. But what we fail to go back to is, how do you write an email? How do you write a text message? So we start from that that front, so that we could really help them, because we cannot expect them to know everything that people who have been able to study already know. So those in the communities, we will also conduct training needs analysis with them. So if that means the simplest of things, typing, then that is something that we will provide. So yeah, just a heads up, just in case anyone is listening, so you can contact us eventually.
Amazing, amazing. That's some amazing work, Carmen. So again, yeah, it's very, very important to prioritize self-love, self-care. Whatever that you're doing, whatever that your circumstances are, please find time to do the things that you love. That itself will put you at peace. That itself will ensure better mental health for all of you. So yeah, let's move into the next section. And here I just wanted to focus or want you to share techniques on how women can better manage their reproductive health related issues, because we must acknowledge the fact that especially in the global south and other third world countries, the beliefs and norms of our societies have built an unshakable taboo around women's reproductive health. However, we think it's high time that we step beyond these social constructs and take active charge of our own reproductive health. So what are some of the few techniques that women can explore in terms of, being fully aware of your reproductive health and how you can better manage it?
Yeah, well, it really takes a community. So if we're talking about the health and wellness of women, no, it takes the support of the entire community. Therefore, if we're talking about the everyone involved, no, husbands, fathers, mothers, we need to ensure that awareness raising is top to bottom and bottom to top. So really it takes a lot of work from the public health practitioners themselves, the local government leaders, community, like the ones running the community. So it should start in a sense with their awareness, with campaigns coming from government institutions, non-government organizations, and they could look at how can they assist the women themselves. It is only possible if there will be prime movers to because the women can rant about what they are experiencing, but if no one's gonna hear them, no one's gonna respond, then it will be put to waste. So in essence, I think to answer your question, number one is awareness raising, really, about the conditions, about the topics that we are conversing about. Bring this to the televisions, the radios, any kind of media that is available. So the old school pamphlets, flyers about why women need to take care of their reproductive health, why they don't have to be pregnant at an early age, why they need to abstain, why they need to have family planning methods. These should be distributed. So it's really knowledge and information at the very start. Then afterwards, if you have these, you need to also have leaders, champions among the women themselves, to talk about, to have communication skills to promote reproductive health. And then only by then can you have action. It can be translated to action, people practicing, the different lessons that they have learned through the process. So, as mentioned, it really is a whole of community, whole of government approach. And if that is something that can be promoted, from the top to the bottom, bottom to the top, then we can see the changes, improvement in reproductive health of women in different countries across the globe.
Right, thank you. So that is definitely, yes, like you mentioned, it takes the community, it takes the whole world to prioritize this and to really eliminate issues pertaining to women's health. But, I also think we as women also have a responsibility of taking care of our own bodies, being aware of the changes that we experience over, time in different phases of our life, right? And I also think it's very, very important for us to be aware of, in terms of reproductive health, like the sanitary products that we use, and have access, again, like, to these sanitary products, which is also very, very important, which I think is one of the biggest causes for a lot of reproductive health related issues that women face, in terms, starting from like cervical cancer to, many more that I can think of. And also, like, in terms of teenage pregnancies and child pregnancies, is there anything in particular that you would like to share out of the experiences that you've had, like the repercussions, or why we're saying, you as a woman or as a girl, you should be more aware of these things so that you could lead a better life. So
Well, it's not safe. That's the first thing. I understand maybe some of the kids would say, they're in love or they have been married off, but it's not safe, because your uterus is not developed properly when you're still young. So it could endanger not only your life, but your child's life, if you decide to be pregnant early. So if you really would like to commit, then you need to commit also to wait for the right time. It's hard. That's why you can those who, because in some countries I know that it's legal to get married earlier, no? But if until now, well, the primary response needed here is to abolish that, to change the legal systems across these countries, following the Convention on the Elimination on All Forms of Discrimination, no? The CEDAW. But if still plural legalism is available in such countries and it is still honored, then what can be done is for abstinence to be practiced. Even it is even applicable in countries where there are HIV/AIDS cases. The only way is to take control of yourself, of your body, mind over matter, and to really abstain. So, these are just some thoughts that came to mind when you mentioned, child pregnancies.
Yeah, definitely.
So I hope parents reconsider and really provide the guidance needed by the children.
Definitely. Thank you. I know, like, we are not experts to give like advices on these things, but it definitely has to be spoken about, as sisters, as like colleagues, whatever that we can speak about, or I think whatever content that we can speak to raise awareness around this will be of great value to someone who is in need to hear this from another person. So finally, to wrap this up, I'd like you to share your final, words and perspectives on women's health as conclusion, and speak a little bit about women's role in elevating other women's lives, and how it's all at the end tied up to the rights of women and their right to choose. So if you would like to speak a little bit about that and conclude, that will be awesome.
Yeah, so as closing, I think I've made it clear, we've made it clear, not through the conversation that we're having right now, that health is not just about not being sick. It is really physical, mental, emotional, social well-being of someone. And this is worldwide, this is the accepted definition. But what we tend to forget, we tend to ignore the different aspects, of it. Um, I think, given what we have gone through this past months, this past 2 years, of pandemic, we now realize how it is important to really take care of ourselves, to remain healthy, and also to encourage others to do the same. Um, the thing is, with the pandemic, if someone got sick, the tendency for you to get sick, it was really evident if you have seen. No, so we all have to work together, to support each other. It doesn't have to be supporting each other materially, financially, but morally, being there for each other. And it is something that we need to relive. We need to spark, we need to jumpstart among ourselves, because I believe that it has always been there. Various NGOs, community efforts have been in existence through the years, supporting each other. And we just need to remember, how to care for each other. And ultimately, it's about supporting each other is not just good for them, but for our well-being as well. So I would say that health as a basic human right, um, the human rights of everyone are interdependent, and therefore it's not just about individuals, it's about peoples. So the only way forward for us in this new normal, as we call it now, is to ensure that we are not only contributing to our individual health, but also the health of others. So if you know something, share it with someone else. If you are privileged enough, to have access to information, to services, then make sure that others who are not, who don't have the kind of information, could also gain access to it. Our survival is basically dependent not on individuals, but on each other. So let us help, assist, support, elevate each other, become better members of this society. That's about it. Swati, I hope makes sense.
Thank you, Carmen. Absolutely. Just like you said, I 100% agree with you. At the end of the day, it is about coexistence if we are to, do this sustainably, right? So if we are to move forward in a sustainable way, we need to ensure that we coexist with our environment, with other people, and be inclusive of everyone, share the information that we know with each other, look out for each other, be there for each other, and really, relating to this topic, I would again want to reiterate the importance of self-care, to reflect on yourself, to take a moment to look back, and to really prioritize your health at all times, in whatever dimension that we look at. Everything, physical, nutrition, and mental, spiritual, everything is important. And it'll really help us if we have a discipline in life and follow, routines are boring, but sometimes routines help you. So maybe have a routine. And at the end of the day, health is a basic human right. And we have to, as women and as allies of women's health, I think it is everybody's responsibility to understand that everyone have their own right to choose at the end of the day. So what you need to do is to set, create that path, empower people, and not deny them of their rights, and understand when it's a no for something. And we're talking about, it's a buzzword around the world where we speak about no means no when it comes to domestic violence and intimate partner violence. So at the end of the day, all of this boils down to being an ally and coexisting with your fellow people, whether it is a man or woman or any other people with the sexual orientation. So thank you so much, Carmen, for this conversation. I think it really contributed and added a lot of value to Zaharas Dream and our community as well. I hope you all enjoyed this talk. Please leave your comments below in the comment section if you're watching it via YouTube. If you want to take this conversation forward, do let us know and share your thoughts on this so we could maybe set up further discussions around the same. Yeah, thank you so much for watching this, and thank you very much, Carmen. Again, it is our privilege to have you, and we're very grateful to have you as a speaker with us at Zaharas Dream. Thank you.
Thank you.